I won't bother with the other example of evidence. Okay. Any more questions out there? Or is it turning into complete anarchy? Okay, lady with a grey sleeve there, and a lady with no sleeve there. Starting.
I've got a pink sleeve with spots on.
That's the one. Have we got a microphone anywhere near that person? And, sorry, third. Where's the microphone? Can't see. It's all. Okay, start with that one then.
Can I just ask if you think that the complete ban on smoking in all public houses across the country might have led to other poor health outcomes, like in lots of deprived areas where people actually meet there for social reasons. They're no longer allowed to smoke in the pubs are closing down, and they're going and smoking in their own homes and drinking more in their own homes and becoming socially isolated. So do you think it was fair to do a public ban in all public houses, or do you think it should have been left to the public to decide where and when they should ban it or not?
So unintended consequences of the smoking ban, would that be... Bobby, do you want to start on that one?
Well, a couple of things. First of all, we calculated how much was saved from heart attacks as a result of the smoke-free legislation in England, and that was approximately just over 8.5 million. So you have to sort of look at every side of the coin. And quite a lot of regions in the lobbying for the vote, which was a free vote in Parliament around the legislation, a lot of regions actually looked at this, and they particularly looked at public houses, because one of the proposals was that there would be a sort of halfway house, and some pubs would be completely smoke-free, and those that didn't serve food wouldn't be. And what it showed clearly was that we would simply be sending a message out to our poorest communities: carry on smoking, carry on dying early, carry on getting ill prematurely. Having said that, I know the Scots have done, and the Irish have done quite a lot of work that has actually shown that there is some increased isolation among both women and men who have sort of felt, well, now I can't smoke anymore, I can't go to the pub. And so I don't think there's been an increase in smoking at home, because many of those people were isolated in the first place and are smoking at home. So I think it's a mixed picture.
Okay. Did you want to say anything, Gregor or Phil?
Well, yeah, I mean, we know from research that social isolation is one of the biggest factors in poor mental well-being and can lead significantly to higher incidence of depression, anxiety, stress, etc., so mental health problems. It's always the problem with a kind of one-intended big wedge public health approach, which in some ways is fine, but let's not overdo it, because there are unintended social consequences. And if there isn't an integrated way in which people can combine what they need to do in terms of protecting the public's health, but also enhancing. So this is where we need to move away from some of the kind of deficit approach to the asset approach. And if we can find ways of enhancing and looking at social isolation, or looking at things that destroy very important community social networks. And I think some of the unintended consequences of quite well-argued and evidence-based public health campaigning is that it doesn't take that broader picture, and it can actually reduce some communities' sense of resilience. So I'm asking people to look behind some of these interventions, some of these approaches, and look at maybe some of the unintended downsides in terms of mental well-being. So I'd be for anything that increases decreases social isolation. However, having a partner and some friends who do smoke, they do tell me that all the best jokes and all the best conversations are had outside the pub with a very good network of smokers.
Yeah, under the awnings. Okay, well, we'll finish on that one now. Move on to the lady with the pink spots on her arms. Yeah.
That sounds quite potentially lethal, really, doesn't it? My name is Nina Ross. I'm the founder and chief executive of an organisation based in Brighton, and we work with young parents. And my question really for you is about the approach that I've kind of been hearing talked about over the day. The nagging versus the nudging approach, for me, doesn't really fit in with the theme that was coming out earlier this morning around empowering people to be in the driving seat around making their own choices. The service that we run uses nutrition and cooking skills to hook people in, and it's a device that we use to get them to engage. And we find that we don't need to nag or nudge, because actually people can see the benefit directly to themselves for making these changes because they've experienced them. And so what my question is really is actually, do we need to even change that approach from nagging to nudging? Because that just brings out the rebel in me, and I'm pretty sure it does in everybody else.
Okay, good point. Now, is this one for the teacher, Steve?
Yeah, the approach that we use in schools.
Speak to the microphone.
Sorry. The approach that we use in schools is to go into staff rooms and to say that these are a range of things that you can do if you wish to do them. And we talk about diet and exercise and making space for themselves and having a hobby. I mean, these are all the things that my grandmother told me when I was 5 years old. But we find that we get quite a lot of positive response to those things. And if we went in and said, you must, we would just get shown the door. So I think the nudging gently at people and giving them the choice of what they do, but giving them the information that underlies it is an important aspect of what we do.
Okay, John and then Phil.
Yeah. Just to say, I mean, there is an assumption behind this whole session that we are nagging members of the public. I think we do have a responsibility to nag, and we've heard it several times, and there are areas of legislation where we need to be heard very loudly. And one I want to mention is I was a member of the Coalition for Health, which was set up by the previous government and has magically and seamlessly metamorphosed into the responsibility deal under the coalition. I have enormous admiration for civil servants who anticipated this, and it's all happened quite seamlessly. But one of the things that comes out when you talk with people at these sort of levels is, and they need constantly to be nagged to think about joined up ways of doing things and thinking. And so that whatever policy they're putting in from whatever department is for them to ask the question, what are the health implications of this policy? And they really find that very difficult. And that message we just have to keep on at our political masters and say, guys, what are the health implications of this piece of legislation? Because they're not very good at it. And the idea is that one of the things the responsibility deal will do will constantly chide, nag, prod our legislators to think about the health implications of what they're doing.
That would be good, wouldn't it? Because so much is coming out so thick and fast that the health implications are, I can't believe they're being probably looked at.
No,
Phil.
they're not.
I think the issue about providing people with information at the level at which they can absorb it is incredibly important, and doing so repeatedly. Now, if that's called nagging, then so be it. I thought we heard a wonderful illustration of that with the presentation from MEND earlier of some of the practical work at local level that could be done. But as part of our Move for Health campaign, we did another survey and also pulled in research from other bodies looking at children's health. And the remarkable thing is, and I've had 5 children, so I've got experience of this, is the illusion that we all have of parents about what our children are really up to and what they are. That applies of all ages. But a piece of research done by Newcastle and Edinburgh universities looking at parents' perception of exercise and the reality with the children. And it showed that parents believe that on average their children were doing 2.5 hours a day of activity of one sort or another. And when they actually surveyed the children, it turned out to be 34 minutes. But much worse than that is that in terms of the sort of standard of trying to achieve about an hour a day for children of activity and keeping them healthy that way, 86% of parents believe that boys were doing well more than that, and they believe that 56% of girls were.